As far as the clinician goes, I mean, that's really what drew me to Elios. We were dealing with very high staff turnover. We had very challenging jobs and client populations on our clinical side, and the administrative burden of that documentation was overwhelming and definitely played a part in why people sometimes left the organization. And as a COO at the time, I felt that when this was brought to my attention, this is how I was going to justify the ROI. I didn't need it to increase the productivity. I didn't even want to talk about increasing productivity. I really wanted us to focus on how is this going to help us keep one or two staff a year, and that's going to pay for the product. That's all I needed. And that's the pitch that I made to the CEO at the time. If we just keep one or two staff from burning out a year, that covers the cost. And we didn't have to do anything. Not to mention a lot of other side benefits that I anticipated, allowing clinicians who were providing good service, but it seemed insignificant compared to the burden of documenting it. And maybe they just didn't document that 8-minute phone call they had with the client, right? And then that's lost revenue for the organization. Or, I mean, there were lots of little ways that I thought, oh, yeah, it's also going to have an impact to productivity because it's going to allow them to capture the services that they were already doing, but maybe not getting credit for. And I think that, I left the organization not far after that launch, but I do think that they had some uplift in productivity, not because they increased the expectations necessarily, but because people were able to capture the services that they were already doing. And you could see it in did they meet their productivity targets and then get bonuses? So when you start paying out more bonuses because more people are hitting the targets, that's an indication that something's going real well from a revenue and billing perspective.